Thank you, thank you, thank you, thank you. You know what I just threw around the room? A boomerang. I'm going to tell you about the boomerang referral. A boomerang is a hunting weapon that the Australian Aborigines used. That word has transformed over time to mean something or an action that you put out that comes back to you. And I'm going to tell you how I developed the boomerang referral. When I was in my perio residency, I moonlighted as a dentist. And when I first started, I would get, fillings, a crown here, a crown there. But maybe 3 months in, I started getting a lot of periodontal procedures. I wondered why. And so in order for me to find out, or in order to find anything out in any office, you got to go to the staff. So go to the staff, they tell me, well, when we send our patients out, they either never go, never get there, don't come back, or switch dentists. So I began to think, I'm learning how to garner referrals. They're having trouble sending referrals out. How do we bridge the gap? So I came up with the boomerang referral. And the boomerang referral has to do with your ability to educate, motivate your patients enough that they take on whatever it is that's ailing them so that they're more interested in their own treatment. So for periodontal disease, how I explain it to patients is I make an analogy. And that analogy is like catching a cold. Everyone's caught a cold, so they can identify with that. It goes a little something like this. When you catch a cold, you get bacteria in your nasal cavity. Your nose gets stuffy and inflamed. The body creates mucus. And this is your immune system doing this. The mucus encapsulates the bacteria. You blow it out, cold goes away. If your immune system doesn't do a good job, it lingers and lingers. You go see a physician, he gives you an antibiotic, kills the bacteria, cold goes away. The same exact thing happens in the mouth. Bacteria build up on the teeth, the gums get stuffy and inflamed, it bleeds when you brush. That's because bacteria are alive, and those bacteria seep into the tissues, making your body think that it's inside. So what does the body want to do? Get rid of it, but it can't. The bacteria is actually outside of the body, yet inside of the mouth. So what happens? The body turns on itself, starts eating away the bone, boom, periodontal disease. And 9 times out of 10, when I make that analogy, ding, I see the light go on. And now they want to get rid of that bacteria. They want healthy gums. For you dentists out there, when you send a referral, are you educating your patient about the referral you're sending? Or do they just show up at the specialist saying, my general dentist told me I need to see you? That never works. An example, you have a patient that needs root coverage. Fill out the referral, root coverage number 6. Periodontist gets that, looks at it. Okay, well, you also need root coverage on 22, 27, and whatever else they see, because the referral was just bland and vague. I submit to you that if you send that referral, root coverage, I believe it to be a Miller's Class 2. As far as I know, I think you can get 100% root coverage. If not, please give me a call. That does 2 things. Number 1, the specialist is now on his A game because he's thinking, well, you know what? This guy knows his stuff. So when I send this back, I want him to know I know my stuff, and we're going to make beautiful mouths together. This always works. Take it from me. I'm a periodontist. Now, last but not least, when we deal with patients, it can be exhausting. But when you send for an implant, most people say, oh, we need implants, send the patient. I submit to you that you must be the leader As the general dentist, you should be taking diagnostic casts. You take those diagnostic casts, you wax it up, and you go over that with your patient. Why? Because if you don't, imagine yourself in a car and you're with your patient for some reason or another, I don't know why, but you're both hungry. And you end up at McDonald's. And the patient said, but I wanted Burger King. Well, you didn't discuss the outcomes, right? And so you might be thinking one thing for the implant restoration and the patient thinking something else. Like, I really would like a gold at number 7. Highly unlikely. But if you have the diagnostic cast, you can go over that with the patient. Now, the periodontist, the oral surgeon, the specialist has a guide of where to place the implant, what it is they need, whether or not bone grafting is going to be necessary. Also, CBCT. Why wait for the specialist to get the CBCT? Why don't you do that so now you have a better idea of what's possible and you're not expecting a miracle from your specialist? It's these little things that keep patients coming back in your practice. If they go elsewhere and are educated and get this information, they start thinking, well, does my dentist really know what he's talking about? I want to stick with these guys. But if you start the process in your office, I guarantee you, here it comes, here. The boomerang effect will work for you.